When interviewing for a position as an internal medicine physician, you can expect to be asked a series of questions to assess your qualifications and fit for the role. One of the first questions you may be asked is to tell the interviewer a little bit about yourself. When answering this question, it's essential to be brief and to the point, providing only the necessary information. You may also want to include why you're interested in the position and, if applicable, the circumstances that led you to leave your current situation. A possible answer could be, I initially pursued a different field, but after completing another degree, I decided to go back to school to acquire the prerequisites for medical school. Since then, I've been focused on my medical career. I'm married with one child, and after finishing my residency, I worked as a staff member at a school for a year before deciding to move on. That's what brings me here today. Another question you may be asked is what draws you to this particular hospital or group. It's crucial to assume that the interviewer believes their hospital or group is exceptional and that you should express your enthusiasm for being a part of it. You can start by researching the hospital's mission and vision statements, which are usually displayed on their website, and explaining how they align with your personal values. For example, you could say, I've done my research, and I appreciate the emphasis on community interaction, diversity, and patient-centered care. I believe these values align with my own, and I think I would be a good fit here. You may also be asked about any potential issues in your background that could impact your ability to work at the hospital or group. If you have a problematic past, it's essential to own up to it and explain the steps you've taken to prevent similar situations from arising in the future. If necessary, you should be willing to accept a probationary period or supervision. If you have no prior issues, a simple no will suffice. However, if you do have a problematic past, you could explain it like this. I have a DUI arrest in my past, but I completed the required prevention programs and do not have a problem with abuse. Additionally, you may be asked about your willingness to adapt to the hospital's electronic medical record process. This question is often used to test your willingness to comply with hospital policies. You should express your willingness to comply with all protocols and procedures, saying something like, of course, I would be happy to comply with all policies and procedures, including the electronic medical record process. I want to be a team player and ensure that I'm providing the best possible care for my patients. Finally, you may be asked how you would respond to a code being called in the middle of the night. This is a straightforward question, and the answer should be that you would respond immediately, unless you're managing a clinically unstable situation or in the middle of a procedure. You could say, unless I'm dealing with a critical situation or in the middle of a procedure, I would respond to the code. I would only step back if others were more qualified to attend to the situation. Overall, the key to acing an internal medicine physician interview is to be prepared, honest, and enthusiastic about the opportunity to work with the hospital or group.